G'day, it's Clint here with another tip on reversing rheumatoid arthritis symptoms naturally. Today I want to talk about this concept of inflammation being your enemy. Because some people say to me when they join Patterson Program Support so that I can help them one-on-one, they say, I must avoid medications at all costs. I refuse medications. Those toxic drugs, I'll never take them. Now, that is making medications the enemy. And yet with rheumatoid arthritis, medications are not the enemy. Inflammation is the enemy. And so what we need to do is we need to use all the tools in our toolkit to reduce inflammation. And why do we want to do that? Why is inflammation the enemy? Inflammation is the enemy for so many reasons, but mainly because inflammation in the body creates more inflammation via a vicious cycle. So joint inflammation is simultaneously present with gut lining inflammation. And gut lining inflammation causes more intestinal permeability, which results in more proteins entering the bloodstream, which results in more of your body's self-attack on your joints. So we must keep inflammation low so we don't get into a pain vicious cycle. But inflammation, of course, is an enemy for very commonsensical reasons, which that it causes joint damage, and there's pain where there's inflammation when you've got rheumatoid arthritis or another of the autoimmune inflammatory arthritic conditions. So we must keep inflammation low. And so it's not about having a mindset of avoiding medications at all costs. When some instances, medications serve a very important purpose in our long-term healing plan. For example, I was not able to get my inflammation levels low enough after messing around and experimenting with my diet and supplements and so forth in the first 12 months since I was diagnosed. And after 12 months, I was in a terrible way and then went on to methotrexate. Now, whilst methotrexate wasn't the be-all and end-all to helping me get well, it certainly enabled me to suppress inflammation significantly, and without it, I would not have had low enough inflammation levels for my body to be able to have enough leeway or breathing space to get some healing done like I was able to. Medications, diet, exercise, stress reduction, and supplements. They're our 5 tools in our toolkit. And if we say, I will never take medications, that's like being a plumber and trying to fix your kitchen sink while the water is rushing through it, and looking at the tools in your toolkit and looking at things like your plunger, your screwdriver, your plumbing tape, and your wrench, and saying, I'm going to try and fix this sink, but I'll never ever use the wrench, no matter what. It's out of the question. And then finding that the suitable tool for the amount of water flow and problems with the sink that's required would be the wrench. And so then to avoid using the wrench means that sink will never get fixed. And that's not what we want. We want to fix the sink. So if we need to use the unwanted tool, which is the wrench, so that we get the sink fixed, then it makes the most sense. And so that's my thought process around disease-modifying drugs and biologic drugs. These drugs are not the enemy. In most cases, they offer a suitable match to symptoms to allow a long-term game plan, and that game plan ends with the potential of being able to taper those medications downwards. Now, that is a different approach than trying to avoid them altogether and then putting up with ongoing high levels of inflammation for years and jumping between painkillers and prednisone as short-term pain relief, which is a terrible strategy. Okay, so the only enemies with medications are ones that will cause us to have exaggeration of the condition. Exacerbation of the condition is what I was after. And that are the prednisone, non-steroidal anti-inflammatory drugs, your proton pump inhibitor, antacids, and some of the sleeping tablet brands, antibiotics. And so these are enemies, sure, but the disease-modifying drugs and the biologic drugs, when administered correctly, carefully, thoughtfully, for the right symptoms, normally provide far more benefits to a long-term healing plan than they do negative side effects. So that's my thoughts for today. I hope this is really helpful for you. If you've got this mindset that medications are the enemy, inflammation is the enemy. And so we need to treat with great caution our inflammation levels and keep them low. The two non-negotiables of our program are low pain levels all the time. That's a non-negotiable. The other is to be not worsening month to month. So if we can keep low pain levels and we're not worsening month to month, we will see victories as we deploy all the other natural aspects of the Patterson program. So I hope that's super helpful, and I wish you a really happy healing day. And if you want more from me, make sure you subscribe to this YouTube channel, and also follow our podcast. Got a podcast, iTunes, and join our mailing list, pattersonprogram.com. Have a wonderful day.